Hello, I am Amanda Lippa.
And I'm Neil Johnson.
We are senior SRNAs, and today we will be teaching you how to insert a pulmonary artery catheter, which we will refer to as a PA catheter for this video.
The PA catheter was first introduced in the 1970s and significantly increased the amount of patient diagnostic information available to clinicians. PA catheters allow for monitoring of core temperature, central venous pressure, pulmonary artery pressure, cardiac output, and pulmonary capillary wedge pressure. Some PA catheters allow for monitoring of mixed venous oxygen saturation. After watching this video, you will be able to describe the indications, contraindications, and complications of PA catheter insertion, as well as the steps involved in inserting a PA catheter. The indications for PA catheter insertion are unexplained or unknown volume status and shock, severe cardiogenic shock, patients with suspected or known pulmonary artery hypertension, and patients undergoing high-risk surgery. The contraindications to PA catheter insertion are infection at the insertion site, the presence of a right ventricular assist device, insertion during cardiopulmonary bypass, lack of consent, severe tricuspid or pulmonary valve stenosis, right atrial or right ventricular mass, and tetralogy of flow. The most common complications during PA catheter insertion are atrial and or ventricular arrhythmias. Less common complications include misplacement due to looping of the catheter, knotting of the catheter, and myocardial vessel or valve rupture. In order to perform a PA catheter insertion, you must first have a central line inserted with an introducer hub that allows passage of the PA catheter. A second person will be needed to assist in the procedure. The first 6 steps will describe how to prepare the PA catheter for insertion.
Step 1. Maintain a sterile field. Step 2. Remove the PA catheter from packaging. Apply the protective sleeve over the catheter. Step 3. Use the provided syringe to check patency of balloon by filling with 1.5 mL of air. Then deflate the balloon. Step 4. Flush the infusion lines with sterile saline. Cap the infusion port. Have the assistant connect the right atrium port to a CVP transducer. And connect the PA port to the pulmonary artery pressure transducer. Step 5. Have the assistant zero the transducer to the phlebostatic axis. Check the transducer function by gently tapping the end of the PA catheter. Step 6. Place patient in supine position. We are now ready to insert the PA catheter. Step 7. Insert the PA catheter into the introducer port of the central line with the natural curve of the catheter pointing towards the heart. Step 8. Advance the catheter to about 20 centimeters or until a CVP waveform is observed on the screen. This indicates that the tip of the catheter is in the superior vena cava or the right atria. Step 9. Instruct the assistant to inflate the balloon by stating balloon up.
Balloon up.
Observe the pressure waveform tracing as you slowly advance the catheter. Step 10. At approximately 30 centimeters, the catheter tip should enter the right ventricle. This is confirmed by a sudden increase in systolic pressure. Step 11. Continue advancing the catheter. At approximately 40 centimeters, the catheter tip should enter the pulmonary artery. This is confirmed by an increase in diastolic pressure and the presence of a dicrotic notch. Step 12. Continue advancing the catheter until a pulmonary capillary wedge pressure is observed. This is confirmed by a sudden drop in the mean pressure and a change in the waveform pattern. Step 13. Instruct the assistant to deflate the balloon by stating balloon down.
Balloon down.
Step 14. Lock the protective sleeve to the PA catheter and document the final depth of the catheter.
To recap, we have described the indications, contraindications, and complications of PA catheter insertion, as well as the steps involved in inserting a PA catheter.